It is an honor and privilege to be here today. It was so great to catch up with colleagues. I was chatting with Wendy a little bit earlier, and reflecting back about 10 years ago, she and I were in a different county, running different hospitals, and we were given a state of healthcare then. Got a chance to meet and chat with Brian over here with OH, so again, it's a great opportunity for us to even get together and also collaborate. I got to get two things out of the way, though, really quickly. The first thing, I might be disappointing some of you in the room. I've been hearing it in the community. They were so excited that we have all of those cranes and everything. Folks were thinking we were building a Target. We're not building a Target. Don't boo or anything like that. The other thing, the other thing is, in case you saw me sitting there, I am wearing my Willy Wonka socks. So my oldest daughter begged me to wear these today. So I just had to get that out of the way. So I'm already a minute into my time, so let me get going. When you're building something like Lake Nona, we start off with a higher vision, and I'm just going to summarize this really quickly. We will be a master plan destination focused around health and wellness. We're going to be a highly focused in on creating a overall consumer-centric patient experience, which has a highly connected network, and really focused in around our promise around whole person care of mind, body, and spirit. An easier way for us to remember some of these things is working off of 4 core principles: delivery of whole person health and wellness, to be an excellent community hospital, and being designed to where there will be a living laboratory and an innovation hub for healthcare and providing health. And also, we think we are uniquely located very close to the airport here around destination health and wellness. So I want to give you a little bit of an update about where we are today, so if you drive by the property. So we're planning today for health and wellness of tomorrow, just about the hospital itself. We're going to be opening up in late third quarter of 2026. It's going to be a 10-story building. We're going to open up with 80 beds and 240 shelled beds. We're going to have ORs, endo suites, cath labs, emergency department, imaging, and we're going to have a big focus on both robotic and also incisionless surgeries for us to be an epicenter there. Focusing on technology to create a very unique patient experience around having patient smart rooms that allows, how do we take advantage of technology so we can use high tech to create a high touch with our patients. Across the promenade from the hospital, we're also building an area that we're going to have a medical office building. We'll have cancer services there, radiation oncology, infusion center, as well as retail space, which is going to be focused on health and wellness. We're talking with different vendors around different restaurants and various things in which that we're going to have out there, and also be an area where community engagement activities happen, and I'll share a little bit about what we mean by that. So I wanted to give you a brief update as well around the site itself. So over on the left-hand side, you can see that we just started pouring the second floor. That happened about two nights ago. A little bit of just dumb facts for our site. We have over 1,100 pilings that go 90 feet deep, and it's about 18 miles worth of cement. So that's probably some of the safest land you'll find here in Central Florida. It is exceptionally stable. And I had an opportunity, and myself and a few of my colleagues here, to go out onto the site, and so I asked, is there any ability where we can go up into the crane? They're like, absolutely, of course. I'm like, what about safety? I'm like, well, then put on this yellow vest. So I thought that made a lot of sense. So we climbed all the way up, and we had great pictures and great views of the whole community of Lake Nona. But we always learn lessons in life every single day. So on that bottom right-hand side where there's that red circle, once we're up there, like, hey, Doug, you want us to send up a drone so that we could take pictures? I'm like, why didn't you tell me that before? So before you climb up, it would have been good to know, but again, it was a good experience for us to have. So we're being very intentional about what we're building there in Lake Nona, really focusing and working off of what's been built here in Lake Nona around innovation, community, and health and wellness. So just some of those examples of what we're looking at is Lake Nona is a beautiful community, especially during the day, but even at night, it really comes alive. It has beautiful lights, colors, it is vibrant. We are integrating a lot of that look and feel into the hospital, and you can see some of the renderings that we have there on the right-hand side, really trying to incorporate that sense of community. And also, we're being very intentional about the design and look and feel about the hospital itself. around the whole philosophy of whole person care. We want to be a pedestrian-first environment where that we create space where folks want to come into the hospital even when they're not seeking care. So we have the higher atrium ceilings, big windows, a lot of fresh air coming through the hospital. This is an area I just want to spend a little bit of time. So on the left-hand side, that's an aerial view of the rendering of our site plan. So on the left-hand side, of course, is the hospital. So on the right-hand side is where we're putting plans for the retail space, and further on top of the rendering there is where we're putting the medical office building, so that we have visions of building an amphitheater later on. So maybe even on a Saturday night, Sunday evening, having a fall music series. Folks coming into the campus be able to eat at one of the restaurants, be able to attend one of the music festivals in which we will host. We want to be an active part of our community's lives, not just when that they're seeking care, but also just about of their daily life. We're also working with Jeffrey, so that we're having him to commission a handful of pieces there. And I'm really running over time, so let me kind of get to just some really cool pictures. Working just some of the renderings of some of the patient smart rooms. We're working with a handful of companies. One is then on the right-hand side, that is a cobot. I'm working with a company out of Korea and also some other physicians who are helping to develop a cobot that'll help with OR cases at night, picking the cases for the cases tomorrow. So that we'll be able to then maximize the moment that you can train one of these cobots, then you'll be able to train thousands. Being able to free up our employees' time to spend more time at the patient bedside. So hospital, destination, health, and tourism, and I'll skip over this slide because I am running a little bit late, but one of the things that we're focused on is around innovation, and one of the areas that we're looking at is around incisionless surgery, using directed energy. So one of the standard procedures today for a liver cancer procedure is using either a robot or minimally invasive. The surgery takes about 4 hours. The length of stay is about 2 to 2.5 days. You have a post-op pain at about 8 or 9. Today, using histotripsy, it uses very precise ultrasonic waves to create microbubbles to help destroy the cancer cell there on the liver. It just gets absorbed into the body. Treatment takes about 2 hours. The patient can go home same day, and it feels like you did about 100 crunches. So those are just some of the things that we're looking at bringing here to Lake Nona, so that we want this to be a destination for folks that would come in from not just here locally, but then from all over the nation. So I talked a lot about all the technology and all that cool stuff, and we're very excited to be a part of the community. But bottom line, we just love caring for people. We are so excited to be a part of the Lake Nona community, and you guys have been very welcoming. Now I just want to say thank you. And I am done. Thank you all.